spleen, the anatomical position, this the posterior end and the anterior end. The posterior end is rounded and medially near the thoracic vertebrae, and the anterior border is broader and it will be the lateral most, and it has three borders: the superior border with the notches, intermediate border which is the continuation of the posterior end, and the inferior border. The hilum lies above the intermediate border. There are two surfaces, the diaphragmatic surface and the visceral surface. To the diaphragmatic surface, the diaphragm, the lungs, the posterior diaphragmatic recess, and the three ribs, 9th, 10th, 11th are related. And to the visceral surface, you can find the gastric impression where the fundus of the stomach is related, and to the renal impression, the anterior surface of the left kidney will be related, whereas in the colic impression, you will be finding the splenic flexure or the left colic flexure, which is the continuation of the transverse colon to the descending colon. And above the intermediate border, you will be finding the hilum, which will be having the splenic vessels. And now let's come to the Harris dictum. Harris dictum is the law of odd numbers, which is applied only for the spleen. So the 1 inch is the thickness, 3 inch is the breadth, 5 inch is the length, 7 ounces is the weight, 9th to 11th ribs are found in the diaphragmatic surface. Ligaments present in the spleen. There are three ligaments, that is a gastrosplenic, linorenal, and the one which is responsible for the position of the spleen is the phrenicocholic ligament, which is the ligament arising from the diaphragm and getting attached to the left colic flexure or the splenic flexure. Because of this is the ligament due to which when there is a patient coming with a splenomegaly, the spleen will be growing obliquely towards the right iliac fossa.